Welcome back. You're still watching the Afia Morning Show live from Enugu, Nigeria. I'm Nathalie, and now, like we said, we're going to be discussing the chances and frequency of multiple births happening in current times, as well as giving hindsight on what it used to be like in the past. We're joined now by a consultant obstetrician and gynecologist, Dr. Ifeanyi Okonkwo. Dr. Okonkwo, thank you so much for being with us on this miraculous Monday morning on the show. Thank you.
Thank you very, very much. I'm happy to be here.
Happy to have you on as well. So could we get your first brief reaction to the birth of the quintuplets in Enugu on Thursday? What was your reaction when you heard about this news?
Well, miraculous things do happen. In our practice, there are certain things you see, certain expectations. But I was happy that at the end of the day, it was a good outcome so far. The babies seem to be doing well, and the mother seems to be doing well. So I guess we'll still discuss certain details about these events.
All right. So could you speak to us very quickly about the uniqueness of multiple births? We know that you can have twins, triplets, quadruplets, but how rare is it to have 5 babies at once?
Well, yeah, twins, we know, seem to be more common, and even in recent times. In fact, in Nigeria, in the Yoruba land, they happen to have the most frequency of twin births, natural conception. But when you're talking about higher order multiples in this situation, 4 babies, 5 babies, 6 babies, they're quite rare. The higher the number, the more rare it is. For 5 babies, that's as rare as 1 in, say, 50 million people, or 50 million births, rather. So it's quite rare to have that happen, especially if it happens to be a spontaneous thing. There have been a handful reported over the years. So very rare, I would say. More rare to be able to succeed in all the babies making it. So in this situation, it's been a good outcome so far.
All right, let's go on a quick break now. I think we're having a little fault, and when we do return, we'll continue this conversation. Hold on with us, Dr. Okonkwo. The morning show returns in just a second. Stay tuned. Welcome back. You're still on to the Afia Morning Show. Apologies for that minor interference. Now we're still with Dr. Ifeanyi Okonkwo discussing this miraculous birth in Enugu. So let's come back to this now. We're looking at a case where people are married for so long, they don't have children, and eventually they now are blessed with a bundle, and this is a literal bundle of joy. What could you walk us through what really could lead to such an outcome? Is it a coincidence or is it a miracle?
One may consider it there's a thin line between coincidence and miracles. Live births generally, no matter whether it's 1 baby, 2, it's still a miraculous thing at the end of the day, because there are certain questions we still really can't answer about how births come about. But in this situation, for it to happen spontaneously, especially in these infertility cases, these are things we see every day. People go through a lot, years and years of trying to achieve a pregnancy. It doesn't work for one reason or the other, and we have to intervene. There are different things that happen. For it to get to this point where a pregnancy like this occurs, depending on how it comes about, either way, it's still a big deal. For it to happen spontaneously is a much bigger deal, because if you look at the biology of these things, you really wonder how you ended up with 5 babies at the end of the day. So yeah, it's really a big deal, if I may say. And of course, someone has already said earlier in the show, to raise 5 babies in this economy, to have them all at once, it's a blessing on its own, because it seems as if it saves, it justifies that time spent trying to have the babies, saves you the years of having to have multiple pregnancies. But then raising 5 at a time, it's not an easy thing.
And that would be OG.
Also, you come from the angle of sciences, by the way, the science that's attached to having multiple babies, like 5 at a time, the possibilities and all that. Can we also walk us through it briefly?
Okay, trying to put it in simpler terms, the biology is designed in a way that it's supposed to be one baby at a time. You know, during the menstrual cycle, during the production of the egg, one egg comes about, millions of sperms are trying to get to it, one eventually gets there. So that is the straightforward biology of it. Then when you're now looking at how these other things occur, sometimes you may have a situation where one pregnancy divides into two different babies, you know, usually, or sometimes, you know, you may have two eggs being fertilized at the same time. So that is how you come about multiple births that may either be what we call identical twins, or maybe non-identical, or soror, or the other. So depending on how these things happen. So for it to happen in such a way that 5 babies occur, you may have a situation where one egg has divided into 2, or you know, you ended up with 2 fertilized eggs and then they divide or something like that. It's rarer if you're not looking at a situation where maybe multiple eggs are produced at the same time and they are fertilized. Of course, in this day and age of assisted reproductive techniques, where we use medications and even do things like IVF and all that, it increases the chances of this occurring. So in spontaneous situations, very rare. In situations where medications come in, where ovulation is boosted and things like that, it increases the chances of multiple pregnancies. But for it to get up to this level, most times when we have this kind of situation, the assumption is that, okay, it was either an IVF or something like that. So it doesn't mean it cannot occur spontaneously, but it's quite rare.
Yes, an old study said that 1 in 55 million people are able to conceive naturally multiple births such as this. 1 in 55 million people. Have these statistics changed over time, or are we still looking at these indices? Are we still looking at these statistics? Is it still 1 in 55 million?
It's significantly less than that. The major reason is because of the advent of assisted reproduction. If, you know, for instance, you have ladies not having children much earlier, you know, maybe get married a bit later, or maybe they've gotten married, there are certain issues, they've not had pregnancies and all that. So it gets to a point where, you know, at a much older age, they're able to get pregnant. For spontaneous pregnancies, yes, I agree with that. 1 in about 50 million or even more, depending on the region. But for you to have this occurring in this situation, the number keeps getting, you know, the frequency keeps getting more. Because when IVFs, for instance, are done, usually multiple embryos are reimplanted into the uterus at the same time. So you end up with multiple babies developing at the time. Of course, there are ethics to how these things are handled. But, you know, let me put it this way, most IVFs that are done will more likely end up with more babies than one. So with this alone, if you bring in the factor of assisted reproduction alone, it has significantly increased the frequency of that. That 1 in 55 million is a wide number. In fact, in a percentage, it's probably even more. Maybe looking at 5% of what they call it, IVF pregnancies will likely end up with higher other multiples.
Well, in this case, just to state this caveat, it is yet unclear if this was done through assisted reproductive measures or if this was a natural conception. That has not been disclosed by the medical professionals, and professionally so as well. I don't think that is really the focus at this point in time. So we're yet unclear. We're not even clarified on how it was done. But what we know is that this is a 45-year-old woman. So I want us to talk about age and how it can affect the tendency to have twins, triplets, quadruplets. How does that change over time?
Okay, now in extremes of ages, certain things are more likely. These supposed unusual situations are a bit more likely at extremes of reproductive age. So once you have women in their 40s and above, chances of certain things are more. But we're now looking at it in the context of pregnancy, conception possibilities. The higher the age, the more possible issues that can come up. having multiple pregnancies at a higher age, it comes with certain risks. For example, older women tend to have more risk of chronic medical disorders like hypertension and diabetes and things like that. These are things that can easily complicate pregnancies and easily lead to possible complications in the woman. So you now have women in their late 40s, 50s, even in rare situations, 60s, having pregnancies now. Of course, most times it's through IVF because the ovarian reserve and potential of fertility decreases as the age goes up. So there are risks of having these babies, especially multiple babies at higher ages, in both the medical risk and even other risks involved. Raising a child at that much older age, of course, we know the challenges that come with that. So, these are issues, these are key issues when you're talking about assisted reproduction. The ethics around it and whether it's justifiable. Of course, one pertinent issue is there an age limit to when you can comfortably offer a woman IVF and things like that.
Okay, also talking about possibilities of giving birth to, 5, 4, and all that. Like taking it back in time and now. Is it natural birth or always through CS? Can you make us understand that from the yesteryears and the now? How was it? How were they giving birth then, when it amounts to so many babies? Was it a natural birth or still through CS? And as in the now, is it still possible for a natural birth or still CS?
Okay, well, the practice has evolved over time. We are now more in the practice of preventive medicine, such that there are things that seem more unacceptable these days. Of course, much earlier, when multiple pregnancies do occur, one would assume that quite a number of them went through trying vaginal deliveries. There are issues that can come up with doing vaginal delivery in multiple gestation. Twin pregnancy, yes, quite a number of times you may be able to handle it with a vaginal delivery, depending on certain factors, how the baby is positioned, things like that. But once you're having more than two, their position is really going to affect each other. And usually when you try to do a vaginal delivery, one of the major things you're interested in is it the head of the baby that is coming through? Of course, that also has a factor to play in terms of the weight of the baby. But if the head comes through, it helps most of the time. The higher the number of babies, the earlier labor is likely to settle. So, and of course, the smaller the babies are likely to be. So you may argue, yes, the babies are smaller, you may be able to deliver them and all that, but there are possible issues that can arise. Using this case as a reference, we saw that she ended up having some bleeding, having abruption placentae, as they mentioned. These are things that will not allow you the luxury of trying a vaginal delivery. Back in the days when they tried vaginal delivery more, I don't know how many of those babies were able to make it at the end of the day. Now looking at having babies as small as 1 kg, you have the benefit of putting them in incubators to be able to make up for the number of weeks they are lacking in trajectory. So these are things that are put in this higher number of babies.
Right.
You may end more towards the cesarean section where you can control the outcome of things and be able to allow these babies not undergo the kind of stress that will cause issues at the end of the day.
That's right. So what you're saying is, in the past, when we did not have cesarean sections being proliferated, that we would have high rates of maternal mortality and perhaps death of the infants even before they're able to come out because of the lack of that technology. That's the hindsight we're seeking for. In the past, when these women would get pregnant and they had multiple births, quintuplets, septuplets, what was it like for them without the cesarean section? Did they die? Did the children survive? Dr. Okonkwo, go ahead.
Yeah, maternal mortality is one of the single factors that we used to judge how well a hospital Okay, I'm still with you.
Yes,
Yes,
we're looking at the past. You know, now we have technology, CS technology that makes it
Okay.
easier. But when that technology did not exist, and women would get pregnant and with 5 babies at once, 4
The
babies.
survival rate.
Yes, what was the survival rate of both mother and child?
Oh, wow. Mortality rates for both mother and child, both maternal mortality, infant mortality, perinatal mortality was quite high.
Okay,
And
sorry,
especially in this part
it's
of the
breaking
world
up.
where
It's breaking up a
technology gets
little, Dr.
much, much
Okonkwo. Could
later.
you rehash that point? Could you
know,
rehash that point? We lost you for a minute. You said the
more developed
Go
areas,
ahead.
they've been able to circumvent some of these.
I think we're having a
Okay.
little network delay. Yes, we're talking about the
Okay,
mortality.
rates
Yes.
much earlier was much, much higher, especially. Okay, am I with you at the
Yeah,
moment?
sure. Just go
I don't know.
ahead. You
Can you
just
see me? Can you hear
track
me?
back a bit, then.
Okay, fine.
Yeah.
So, mortality rates used to be much higher. With the advent of technology, we try to reduce it more and more. Of course, for places where these technologies are not really there, it still makes it more difficult. Cesarean sections have gone way back. I mean, it's proposed that Julius Caesar was one of the first babies that was delivered by cesarean section, hence the name. But, you know, in as much as it's been there, it's been evolving in terms of how much more you can do with it. It's not just about delivering babies, it's also about what's the quality of life at that point in time. How can you improve their quality of life? Mortality rates used to be much higher. You can imagine having this kind of 5 babies way back as, say, 50 years ago, which seems long, but it's not that long ago. I'm not sure how much they were able to do, especially in this part of the world, to be able to help these women. And if you really think back, how many quadruplets or septuplets or whichever number now do you know that maybe were your uncles or your grandfather or whatever? How many of them were actually twins? Let's even start with twins, not to talk of triplets and quadruplets and things like that. So you may hear stories from time to time. Oh, there were supposed to be 3, maybe 1 person survived, things like that. But as the years draw on, as technology gets better, you tend to see these numbers more and more. You tend to see more documentation, because these are things that really help us. Documentations were not widespread back in the day. You could only maybe come across 1 or 2 publications and things like that. But now that these cases are documented, for instance, this lady that just had hers just a few days ago, we're already talking about it on the news. A lot of people are hearing about it. Of course, that documentation will be there, for a long time. So there are a lot of things that were not, documentable at the time because of the, issues they had. But of course, it's very important to note that mortality rates were much higher back in the day. Now we are stamping down on them so much, especially in facilities where they have, things to be able to help.
That's right.
But in recent times, right, what is like the survival rates regarding the fetus and the mothers? Can you walk us through the survival rates of having those numbers of babies one time?
Okay, I can even tell you that there are certain countries where they pride themselves so much with the fact that their maternal mortality rates are as low as maybe 1 or 2. In fact, some countries 0. Some countries that advance so much, like Sweden and the rest, pride themselves with these things. Incidentally, in this part of the world, we're still, struggling with some of the numbers. Now we are looking at things like 100 or 200 or thereabouts mortality rates. When you're talking about mortality rates, there's a way it's calculated. This is not really a percentage thing. But if you were to put it in percentage, maybe talking about 2%, 3%, thereabouts, But these numbers vary depending on the location. That is the important thing you have to note. In this part of the world, we still contribute, if I may use that word, a significant percentage of mortality rates and even perinatal mortality. Sorry,
Right.
when I mention these terms, I'm talking about the mother, the baby, and things like that. So the numbers are still there. We're still making efforts to reduce these numbers as much as possible by making sure that some of these services get to the rural areas. Those are the key areas that you'll be able to help to mop up some of these mortality rates.
Okay, let's talk merits and demerits of having multiple births. Audrey talked about the economic implications of having to look after 5 children, 5 babies at once. And, you know, of course, there are obvious benefits of that, especially if you've been waiting for so long to have even one child and suddenly you get 5 at once. So could you walk us through whether people should hope to have multiple births, or, you know, another side they should look at if they even have those hopes, merits and demerits?
Okay, yes, of course, everything has its pros and cons, everything has its merits and demerits, advantages, disadvantages, whichever, you know, terminology you want to use to work it out. One thing is, you know, for what you consider merits. One thing is that if you have multiple babies, of course, it seems to save you the time and the stress of having to have had multiple pregnancies. Imagine having these 5 babies now, which if you were to have the one, even if you do it every year, it's going to take you at least 5 years, but with the physical toll and medical toll and all that. So yes, there are merits to it because it gives those that seem not to have hope, especially in this day of where IVF is more possible. We see hundreds and thousands of patients every other week, every other month that have these challenges, and then we'll walk them through what the issues are. Where we're able to resolve some of the problems, we do that, you know, without having to go through the pathway of IVF and all that. But these technologies have come to stay. It helps to give hope to those that ab initio thought, okay, we can't have these babies, there's no hope for us and all that. If you're able to work out the factors and the kinks, you will be able to give them the hope of achieving a pregnancy. However, like I've mentioned earlier, there are ethics to this practice in terms of setting limits to what you do. What's the age criteria? How many babies are you allowed to carry at a time? There are certain places where they are putting an embargo on the number of embryos you are allowed to carry at a time, which is 1 at a time, to be able to avoid some of the issues that come with it. Of course, the population, explosion is still there. Imagine having this number of babies. At places as, far as China, they have limits to the number of babies you're expected to have in total, not to even talk of, having IVF and things like that.
That's right.
So yes, it does give a lot of hope to women that, thought, okay, they couldn't have babies, go through the rigorous process of IVF, if I can add, because some people think it's just a walk in the park. It's not. There are a lot that goes into it to be able to prepare your body, prepare your mind, both the financial implications, and then be able to go through the process of
It's great that you talked about financial implications, because I want to now ask you what it costs for a single IVF procedure. What does it cost, and what are the chances of your money yielding results at the very end?
Okay, finances vary, let me put it that way. There are certain steps that you go through before you actually get to the process of doing the IVF itself. And these are some of the factors that may vary. Trying to put an average to it, if we're to have an IVF process done now, it's very unlikely that you're going to part with maybe less than 2 million at the end of the day, and put it that way. Like I said, these figures vary a bit depending on the facility and depending on what exactly you're trying to achieve. When you try to isolate certain things, it may seem as if the cost is a bit less, somewhat, but when you put into consideration the preparatory stage and then going through the different steps, the financial value is a bit high. For some people, it may not seem like much. For the less economically favored people, it's quite a lot. You can't be asking those at the bottom of the ladder to afford certain things to be able to do an IVF. I know the number of patients I see at times when you talk about these discussions of IVF, it seems as if that's the end of it, because they're not able to afford some of these things, and then you can only offer your apologies where you can. And then those that are able to put things together, probably sell some properties, do a lot of things, they have these chances. Now, speaking of chances, there's a failure rate with IVF. Of course, IVF is not 100%. If you're able to have a success rate as high as, say, 60%, 70%, 80%, that's quite high. And a lot of things have to go into ensuring that these things work out to that level of success.
What are some of those things? And while you speak on that, can we talk about the interaction between ethnicity and multiple births? What is the prevalence among Ndi Igbo? What is the prevalence among other ethnicities?
Okay. One of the statistics to that is that in the whole world, the Yoruba land in Nigeria have the highest or one of the highest number of multiple gestations. Twinning is quite high there. You see all the spontaneous pregnancies that happen. There are certain factors to it though, but statistics speaking, it's much higher in the Yoruba land compared to us. The numbers here, not as much. There, of course, when you talk about some of our traditional values, there are certain emphases that influence some of these decisions. Of course, one of them is the seeming preference for male children. You see women that may have had a female child back to back, and they're still kicking and trying to say, oh no, we need to have a boy, And then sometimes at that point, they may be at an age where fertility becomes more of a challenge. Then you're trying to achieve having a male pregnancy by doing an IVF, to be able to circumvent some of the issues surrounding it. Good and fine. So these are things that create a bit of a challenge. Other things such as the paternity of the babies, the source of the egg, source of the sperm, certain issues come into play when you're trying to address these fertility challenges. So at the end of the day, you try to lay your cards on the table. Okay, these are the issues you have. These are the ways that you can, circumvent them by throwing a bit of a shifted option to it, if I may say, to be able to help achieve it at the end of the day.
All right. Now, final question from me here on this side. There are people watching this, seeing the 5 cute little babies in those incubators, and they're wondering, God, when? When will it be my turn to have twins? Would I have quads? Would I have triplets? What are the chances? Or let me make it more interesting. How can a couple decide that they want a multiple birth and actually work towards having that multiple birth? Are there times in a woman's cycle that should be considered? Walk us through how a couple can increase their chances of having a multiple birth if that is what they choose.
Okay. First of all, yes, I like the fact that you use the word chances. Sometimes people think it's cast in stone that once you do this, it must be multiple pregnancies and all that. We know that one of the most likely way for you to have multiple pregnancies is through an IVF, like I mentioned before. However, even with an IVF, I'll paint a scenario for you. You have a situation where, okay, maybe like in this one now, no pregnancy before and all that, time is not on their side. You discuss some of these things, they say, doctor, no, we want to hit it multiple at a time. We want to do this a one-shot thing so that people can have as much as 3 babies, 4 babies. We know that we've done this and it's a done deal. Good and fine. But it doesn't automatically mean that it must work out that way. You do what you can to be able to improve the chances of doing this. Even as what one may consider as minor, as using certain medications to increase the fertility potential, to increase the ovulation status and things like that. Also improve the chances of it happening, but it doesn't completely guarantee it. I've seen situations where implantation of embryos, when you talk about embryos, you're talking about the babies that have already been formed, in quotes, and then you implant them back into the womb of the woman so that she'll be able to carry the potential 4 babies or 5 babies that is implanted. In rarer situations, all of them may be able to be sustained. And sometimes you may lose 1 or 2, sometimes you may end up with 2 babies, 3 babies, depending on the situation. Of course, one may not argue that why not put more babies so that in case some don't make it, some will make it, things like that.
All right.
These are the factors that come into play at the end of the day.
All right. Thank you so much, Dr. Ifeanyi Okonkwo, for joining. We're already out of time. It is 9:55 exactly at this point. Up next is the Business Morning, so we have to let you go at this point. Thank you, Dr. Okonkwo, once again.
Thank you very much. Very insightful.
Thank you very much.
All right, and that brings us to the very end of today's edition of the Afia Morning Show. We hope you learned a lot. We hope we didn't make your ovaries start bouncing if you're a woman. I don't know, but I mean, it's just a bundle of cuteness, isn't it? And it's a historic one in Enugu. I think it needs more recognition. They're still there at St. Patrick, so maybe we'll have more visitors. She has not rested since those babies were born, typically. So it's a great one for them. Congratulations to Mr. and Mrs. Odo. Wish you, well, the very best of this humongous blessing. I've been your host as always, Natalie Uku.
And I remain Oji Nwachuku. Have a splendid day and a week ahead. Bye for now.